Welcome to the New Hampshire Public Health Laboratories. As a part of the New Hampshire Department of Health and Human Services, we conduct a wide range of laboratory testing to keep New Hampshire residents safe and healthy. In this video, we'll show you the possible journeys a sample may take when it arrives at the Public Health Laboratories. We receive many types of samples for testing from healthcare providers. This can include clinical samples, like a nasal swab or stool specimen, or environmental samples like food and rabies specimen. We also receive private well water samples at our building main entrance. First, our central receiving staff receive the sample and enter the test information into our database system. This secure system also stores the test results and creates a final report for the sample submitter. Next, the sample travels to the appropriate laboratory for testing. Our virology laboratory tests for viruses like COVID-19, influenza, RSV, HIV, and hepatitis. The virology laboratory is also where we test for sexually transmitted infections like chlamydia and syphilis. In addition, the virology laboratory performs surveillance testing for illnesses spread by mosquitoes like Eastern equine encephalitis and West Nile virus. Our staff are always prepared to respond to new and emerging pathogens. Another laboratory where a sample might travel to is our molecular diagnostics laboratory, where we perform whole genome sequencing on bacteria and viruses. This information can help determine the cause of a foodborne illness during an outbreak. Here, we also routinely test wastewater from across New Hampshire to track viruses like influenza, RSV, and COVID-19. If a sample goes to our microbiology laboratory, we test for bacteria that cause diseases like tuberculosis. We can also determine a bacteria's drug resistance, which is important information for a physician when treating a patient. In addition, our microbiology staff tests shellfish and the water they grow in for bacteria and the toxin that causes paralytic shellfish poisoning. Throughout the year, we also test animal samples for rabies. We work closely with epidemiologists, veterinarians, and animal control officers to provide rabies test results, which is usually within 24 hours after receiving the sample. Our chemistry laboratory tests for drugs of abuse from non-fatal overdose patients, chemical threat samples from public health emergencies, and environmental chemicals in the human body, like forever chemicals. Both our microbiology and chemistry laboratories test for bacterial or chemical contaminants in food samples collected by inspectors from across the state. We also test food samples for residents applying for a homestead food license, which allows them to sell foods made in their home kitchen. Residents with private wells can drop off water samples to our water analysis laboratory. It's important to test your well water since there is no regulatory oversight on its safety. Our staff can test for a number of substances, such as inorganic contaminants like arsenic and lead, organic contaminants like petroleum products, industrial solvents, pesticides and herbicides, radioactive contaminants like uranium and radon, and harmful bacteria such as E. coli. The Water Analysis Laboratory also plays a role in public safety by performing surveillance testing on New Hampshire lakes and rivers. We also conduct radiological environmental monitoring and emergency response testing. Finally, the sample's journey ends when testing has been completed and the results are reported. Most submitters receive their results by mail. Clinical providers also have the option of receiving reports electronically using our secure Lab Online portal, and they get an immediate notification when the results are ready for them to view. We hope you enjoyed this brief tour of the New Hampshire Public Health Laboratories. We are proud to have served our state for over a century, and we look forward to continuing the service into the future. For more information on our services, please visit our website, email us, or give us a call. Thank you.